Right. Can you all hear me?
Yes, sir.
Okay. Sorry about the delay. There was some issue with the internet. So now we sorted it out. Let me share my screen. Right. I know that there were some lectures which were not delivered last week. I think reflexes lecture was not done, no? And did Dr. Lenora talk about sensory organs?
Yes, sir. The lecture was uploaded.
Uploaded. Right. Other one, I think Dr. Champa will do reflexes lecture, but this lecture is totally independent of those lectures, so I can deliver this. So it's 8:20, so we will try to finish as early as possible. So behavior and emotions. These are some aspect of our everybody's life. We know that we all have emotions. We all behave in a certain manner. Usually behave in a certain manner. Sometimes behave in unusual manner in unusual situations. So all these things are can be analyzed physiologically or using knowledge on neuroanatomy and neurophysiology. We can analyze it, and also this aspect is important in psychiatry and psychology about the human behavior and why this was done, why this has happened. Those things are important in analyzing different behaviors of humans, and also probably in forensic medicine also it may be important. Even in the court of law, Hadisikope is considered, the sudden anger and reaction is considered as an excuse sometimes, right? So all these things happen due to our innate nature in certain aspects of our brain. So having said that, let us look at what this is. So emotion. It's a kind of a feeling, but it's not only a feeling, it's emotion have a mental as well as physical components. So certain things happen in our brain which are related to our thinking and functional part of the brain, and then structurally certain other things, certain anatomic changes, certain other system changes may happen, which may appear as physical changes, right? So there are a few words I wish to introduce at this level. You may not understand the full meaning of these things, but as you do medicine and psychiatry, those things, you may come across these words again and again. So one word I wish to introduce is cognition. Cognition, that is an awareness of the sensation and usually its cause. Say, there's a thing called cognitive functions. So cognition means that you are aware of surrounding, what is happening in surrounding. So if you feel some hot air coming towards you, uh, you may become aware about it, and why it has happened, you will look and you realize there's some fire outside, that is the reason. Or if you are in a air conditioned room, if suddenly the air conditioner stopped working, you may feel that something has happened and the environment is getting warmer, and the reason is the switching off of the air conditioner. So that is awareness, right? Cognition. So these cognitive functions, uh, you will not understand it now because you are young and healthy. Your cognitive functions are well. You are always aware of what is happening around you. But in say geriatric medicine is old age. Uh, Geriatric means old age. In old age, your cognitive functions may be lost. You may not be aware of, or you may not be uh, aware as quickly as in a normal healthy adult when you are old about what is happening in the surrounding. Even if something happens, something even serious happens, you will just ignore and keep on behaving as usual. And in a normal healthy person would have run away, but a old person with cognitive function impairment may not respond. So the cognition is that is aware of the of the surrounding. Then there's another word, affect, which is in usual English sense, like you use this word, you know, uh, say, for example, if we tell thyroid hormones affect the metabolic rate or changes, that means in other words, it has some effect on uh, metabolic rate. So that is one English meaning. But affect in psychiatry or psychology or medicine sometimes means different things. That is outward expression of feelings and emotions. So you have some emotion, you feel happy, and when you feel happy, your expression changes. Your face look nicer. You smile, and maybe you jump up or do some thing to show that you are happy. So that is the affect, right? So these are not only seen in humans, even a dog would show these things. Say when he sees somebody, like his owner, the dog would show outwardly, he expresses its happiness. He wags the tail and like tries to run towards the owner. So that is what is called affect, outward expression of happiness or sadness or whatever emotion. And then there's another word which is not very widely used, conation, that is urge to take action. So when you see something or when your emotions drive you, then you have to take some action, do something. So that is conation. And then I told you that emotions have mental as well as physical components. So certain physical things happen in the other systems of the body. Other changes happen in other systems of the body. Say when you have say uh, anger or some emotion like that, what will happen? Your blood pressure will rise, your heart rate will rise, so you develop hypertension, tachycardia, and if you are scared or fear, you may start sweating. Uh, so these are related to emotion, some changes in other systems of the body, right? Right. And then we will have a look at how do we develop these emotions. How do we develop these emotions? Uh, so emotions are generally, as you know, humans have well-developed cerebral cortex. That is the neocortex. Neo means new. So it is new in evolutionary process. So during our evolution, from lower animals to higher animals, like primates and then humans, we consider that we have the highest intelligence and we have the biggest cerebral cortex. That is the outer part with a lot of convolutions to increase the surface area. And so that part is involved in thinking and intellectual functions and calculations, various other things. But emotions are below that. There is an area called limbic system under the neocortex. The neocortex is on the surface, these are inside. and that is there well developed in lot of other animals also. Humans have the best developed neocortex or the cerebral cortex, outer cortex, but the other animals also have this hypothalamus and limbic system. So what is important for here is limbic system are closely concerned with genesis of emotions. Emotions are originated or generated in the limbic system, right? And this limbic system is below the cerebral cortex or the neocortex and has very few connections with the neocortex. So the limbic system is below it, but just below it, but still it has very few connections with the neocortex. But although it has few connections, this neocortical activity can modify the emotional behavior. The activity of limbic cortex or limbic system can be modified by the neocortex, right? But it has only very few connections. But emotions are originated automatically. We cannot turn emotion on or off at will. So happiness and sadness, it comes on automatically. Uh, we are unable to uh, generate it at our will. So that when we want, say, if we want to run, we can initiate that action on our own, some other physical activity. But emotions are coming on and on. As you know, uh, current Ganon actually doesn't have much about this limbic system, but all the versions of Ganon has lot of information on limbic system. And what it says is actually emotions are, say the limbic system has long circuits. So it generates, it goes through and comes back again and again. So that is why sometimes when you have emotionally involved things, say if you have some anger or some good emotional friendship with a good old friend, even after many years, you may remember what you have done together, and like it is recurrent. It comes back and back again, and if it is with anger, very dangerous. Even after many years, if you meet that person again, you may initiate a fight with him. Others around you may not understand why these two are fighting, but it's the limbic system that is overriding the neocortical activity. Normal, usually, average person with normal sense would not fight or behave in that manner. But when there is emotionally involved deep thing in your brain under the neocortex, you will behave like an animal sometimes, right? So you have to understand, and if you know that, you can control it to some extent using your neocortical activity. But emotions are so strong sometimes, uh, even after thinking about something that happened 1 month ago, if somebody badly insulted you in front of a lot of people, told something bad about you, even after 1 month, when you think about it, your blood pressure may rise, you may start sweating, you may start shivering or shaking, and so that is because of activity of the limbic system, right? Okay, and just to put you in perspective, where this limbic system located is, so this outer part is the neocortex. Then underneath that, you have cingulate gyrus, that is called limbic gyrus, and intralimbic gyrus in yellow, that is indicium, gruisium, and paraterminal areas. So you don't have to remember all these things, but you can see important structures like hippocampus is involved, and then even under that there are other things like amygdala, the parahippocampal regions. So that is actually even outer than that, and there are different areas, mammillary bodies. So those are involved in all these things. When you look at it in books, what are the parts of limbic system? different books give different things. So I'm not going to give a list of it. If you want to study what are the parts, if you read one book, you may get list of 10. Another book may give list of 8. So very difficult to set MCQs and things asking about a list. But in the past it has come. But it is almost about to be true all the responses. Unless we give like occipital cortex or something obviously wrong, just which belongs to outside, anything within it likely to be true, right? Um, so limbic system is the area here, in this area under the neocortex, right? Below the neocortex. And then let us talk about behavior, right? How is our behavior generated and governed? There are three control systems. We have what is called visceral behavior, expressive behavior, and manipulative behavior, right? So let's have a brief look at what each one of these mean. So visceral behavior means with our limbic system activity, which can it can alter. So you know very well that hypothalamus has a lot of connections with our metabolism and our internal uh, environment, behavior of internal environment. So it controls metabolism, and sometimes it has some effect on respiration, as I told you earlier. Other systems can be affected when emotions are involved. Respiration may increase, cardiovascular functions may alter, rapid heart rate, increase in blood pressure via autonomic nervous system as well as via endocrine system. So most of these things are coordinated by the hypothalamic activity, right? And then we have expressive behavior. Outwardly, others can see what is happening. That is outward expression of emotion. Say hunger. If you are hungry, you will look for food and start eating. Or thirst. You feel it, you lick your mouth, when you're thirsty, you do that, or you look for water. And when you are having some pleasurable things, you may clap or do laugh loudly. And when you are scared or there's fear, your behavior is apparent from outside, people can realize. Or rage and anger linked to linked things. Anger and rage. යකානගල ඉන්න වෙලාවට right කේන්ති ගිහලා. So grief, that is sadness, those are, so you cry or you go to a corner and do not want to be disturbed, and so that's grief reaction. When do you see grief? You may experience grief when there's loss of relatives. Say for example, if your mother, father, or somebody very attached to you passes away, dies, you have a grief reaction that is natural to occur. So I don't know exactly the current terms, but when we study psychiatry, uh, normal grief reaction is considered as normal. Somebody crying after the death of a parent, you don't have to treat. But if it goes beyond 3 months or so, it is considered as pathological grief reaction. So 3 months is given. Probably even in the old ages, so some religious activities like 3 month alms giving, just to take the person away from that grief reaction. So if it goes beyond 3 months, then it goes to depression and other things. Then you have to treat. But say 1 week or few days of grief reaction, you don't have to panic much, right? And so expressive behavior, when somebody experiencing pain, wincing of the eyes, and your facial expression of a feeling of pain is well known. So the emotions are linked with expressive behaviors, and limbic system and basal ganglia. So there are some motor part, basal ganglia are important. So these things are involved in this expressive behavior. Right. Musai has make its own, yeah, please. Uh, right. And then lot of animals as well as humans do have manipulative behavior. Uh, so when there is some emotion or when there is some uh, certain things that uh, we do not like happen in the surrounding, we may do something to make it more suitable for us. So, for example, if we have uh, say very cold environment, what will happen? We do a manipulative thing. We manipulate the environment. Uh, we may close the windows. We may get some several blankets and cover ourselves. Uh, so we may light a fire to get warm. So we change the environment, or we may find new thing inventions to manipulate the environment and alter things to suit us. That is being done by even animals, right? So uh, there are physiological things within the body may try to adjust to the situation by altering, say, endocrine secretions or uh, causing some shivering or some metabolic activity. So that is occurring physiologically. In addition, their natural tendency to avoid things or to cover things up and like make the environment better for survival. So those things are called manipulation of the environment. So you have manipulative behavior in certain situations, right? All these things are normal, normally expected, right, from all of us. Mm. Right. So now limbic system plays a major role in this behavior of us. And behavior, there are different types of behavior: the sexual behavior, maternal behavior, fear, anxiety, rage, and passivity. So we will talk few words about each one of these. Uh, and last one, this word I would wish to introduce. So rage is anger and reaction, violently reacting to somebody or something. It's called rage. So you may have heard that thing called road rage. So road rage is when you are uh, very driving, for example, if somebody cuts in front of you, you get angry, and if somebody overtakes you in a threatening manner, you feel develop a rage reaction, and you want to follow him and overtake him and do something similar act to take revenge. So that is rage, road rage, right? So which may end up sometimes in a fatal accident. Yeah. And placidity is opposite of it. So even if somebody hits you, you just look the other way around. Then you may start sleeping. So that is placidity. That is the anti-rage, the opposite of rage, the opposite of violence. So that also can happen in certain people, and we will have a look at it. And, so when we talk about sexual behavior, uh, it is mostly, as you know, is governed by endocrine system. There are cyclical endocrine changes in humans, uh, or primates who menstruate. There are cyclical changes in females, uh, and even in males. The endocrine system governs the most of the uh, sexual functions, right? And the nervous system also is involved. And uh, in non-primate mammals, for example, say dog, uh, removal of gonads. It's in a non-primate mammal. Primates are humans, monkeys, apes, and those are primates. So non-primate mammals, if you remove, there have been experiments done on these areas. Removal of gonads leads to decrease to absent sexual activity in both males and females, right? And in such animals, if you inject gonadal hormones, it will revive the sexual activity in castrated animals. So the castrated means the animal get removed gonads or destroyed gonads. Uh, and so, so if you remove the testes of a male animal, giving testosterone, or in a female removal of ovaries, and in such animals giving estrogen have the biggest effect. So that means giving appropriate type of sex hormone to the appropriate sex in a castrated animal has a very high effect on revival of sexual activity. But giving the opposite hormone also works, right? But vice versa also works. So that means you remove the testes of an animal, and afterwards you observe that his sexual activities go down, and and then you give him some estrogen. That will also stimulate the sexual activity and also correct sexual behavior. He will not behave like the opposite sex animal. So male with removed gonads, given testosterone, he will act like a male sexually with a very good response. Removed testes, you give estrogen, he will again act like a male, but lesser response than given testosterone. Right? So higher effects are with the same kind of sex hormone, but even the opposite sex hormone will have a similar effect, but to lesser magnitude. Right? And but on the other hand, in humans, sexual activity is endocrinologically driven, and also lot of social and other learned behavior also come into play. So even if you remove ovaries in females, or even some female going into menopause, really does not reduce libido. It is expected to reduce, but if you really analyze, libido means desire to have sex. So libido is not going down by much, even if you do these things, right? So that is an observation. Uh, and as I told you earlier, so testosterone and estrogens both increase libido in men, right? And also the interesting thing is that giving testosterone will make sexual activities increase, and giving estrogen also will do the same thing. It will not redirect. So if you pay attention to this word, it will not redirect the sexual activity. That means, say if there is a homosexual male, uh, he will have increased homosexuality. Say heterosexual, that is some male who like to have sexual activity with a female, will maintain the same pattern. So this pattern of sexual activity will not change by the type of sex hormone given. Whether it is estrogen or the androgen doesn't change the direction of sexual activity, but it will increase the activity. Right? And then as with, I told you that endocrine functions are important for sexual activity, but brain is also important. Emotions are also important in the initiation of sexual activity, and neural control in the male. So if you remove the neocortex, it will inhibit the sexual activity. Right? In cats and monkeys, uh, say bilateral limbic lesions, it should be bilateral. In the piriform cortex, that is near amygdala, increases sexual activity. Increases sexual activity, and so that means they become hypersexual, right? They become hypersexual, hypersexuality, you see, and they try to have sex with, say, adult females, say even old females or immature females, very young ones. They try to have sex with them, or even Sometimes they may try to have sex with other male animals, that which is unusual in the normal sense, or even try to have sex with inanimate objects, right? That is non-living objects, right? And I used to tell a story several years ago, maybe about 2 decades ago, when I came from home towards the faculty. That was, I had my lunch at home and coming back from home to the faculty around maybe around 1:30 in the afternoon along the Browns Road, right? You know the Browns Road, and there was this not many people were in the road at that time, so 1:32 people. Road was nearly deserted, but there was this motorcycle stopped in the like by the side of the road, which is parked and covered with a motorcycle covering cloth. And I saw a cow approached it, and he thought maybe it's a female cow. අර කන්නඩි දෙකට මේ රෙද්ද වැටිලා නිකන් එළදෙනෙක් වගේ තමයි උට motorcycle ඉපිනුනේ. And he jumped on the motorcycle, tried to mount and have sex with the motorcycle. And motorcycle fell aside, and I could not stop laughing. So probably that animal may have some bilateral limbic lesions in the near the amygdala, right? So that's what I thought now. But at that time, I did not have dash cam or anything in my car at that time. Uh, so those things can happen. Actually, I have taken some photographs in my mobile phone of the similar kind of motorcycles, covered with cloth. Maybe for the next batch, I will put those slides as a PowerPoint slide, right? So even hypothalamus may have sexual behavior controlling ability. And then talking about the neural control in the female, in females, in mammals, sexual behavior is cyclic. That menstrual cycle occurs, and most of the time, the female is trying to avoid the sexual advances of males most of the time, but periodically this changes and female seeks out for a male, attempting to mate. That is, in non-cyclical animals, like animals with heat, සත්තු ඉන්න බල්ලෝ රැළේ යන කාලේ කියලා තියෙනවා. So when they have estrus, or what is called heat, female dog likes to have sex and actively look out for male dogs, right? And so the heat or estrus is seen in mammals that do not menstruate. And in say females, for example, still they have demonstrated that around the time of ovulation, because we want to propagate our generation of the species. So females around the time of ovulation have a natural tendency to have what is called female initiated sexual activity. Most of the time it is male initiated sexual activity, but females like to have sexual activity around the time of ovulation. Most of the time it is female initiated sexual activity is more common in human around that time. And then it has been shown that this emotional or this sexual behavior and the reproductive cycles may be two different things. So in some experiments done in sheep, they have shown that discrete lesions, that is small lesions in the anterior hypothalamus, abolishes behavioral heat. So I told you that in animals with heat, they actively engage in sexual activity, females, around the time of heat. But if you induce some lesions in the anterior hypothalamus, that part will be lost. But pituitary ovarian cycle is not disturbed. The pituitary gonadal, hypothalamus pituitary gonadal axis is not disturbed, but behavior is changed. So that means maybe endocrine part is kind of separate from neural behavior, but in a normal person, both of them work together. And then, is there any effect of sex hormones in infancy on adult behavior? There have been a lot of studies in experimental animals in females in utero or early postnatal exposure, soon after birth or in the uterus. If you expose a female animal to sex steroids, it leads to marked sexual abnormalities in adulthood. Right? So when that animal is born, its sexual activity behavior will become abnormal. In female humans, in utero exposure to androgens do not change the cyclical pattern of gonadotrophin secretion in adulthood. So androgens do not have, in utero exposure to androgens do not have later, any effect on uh, gonadotrophin secretion. But their behavior may become abnormal, behavior may become masculinizing effect. That means behavior may become male-like because we expose them to androgens. And there can be masculinizing, that is male-like effect on behavior can occur in the adulthood of such uh, females, right? So these are all lot of experiments were done, and in order to understand this area, but I don't think still we do understand everything. But these are observations, right? So interesting observations so far mentioned by me is that whether it was castrated animal, whether you give estrogen or the androgen, both them of them have sex sexual activity reviving effect, but more with the same kind of the appropriate type of sex hormone. Right? So that you have to remember, right? That is a very important observation that was made. Right. And then I told you among behavior, sexual behavior, maternal behavior, I talked in the list initially I showed you. So what is maternal behavior? Maternal behavior is try to look after the young ones, give protection. So if you have a very tame, nice, female dog at home, he behaves very well, very kind of controllable under normal circumstances. But if that animal becomes pregnant and gives birth to pups, puppies, after that, treating that dog as usual may be dangerous because he may think, or she may think that uh, you are trying to harm its offspring or the babies and may bite you. So behavior is trying to protect the young ones. So that is called maternal behavior and tries to protect the young ones, like carry the young ones, belle mustagena rangila pattakin, and humans also do the same thing. We try to protect our young ones as much as possible, right? So that is called maternal behavior. This maternal behavior is depressed by lesions in cingulate and retroscleral portions of the limbic system. So that means some parts of the brain are involved in carrying out this maternal behavior, right? And also, uh, it is thought that endocrine stimulation is also there. So prolactin may thought to facilitate it, the maternal behavior. And not only maternal behavior, sometimes even paternal behavior. Even father may be secreting more prolactin and behaving some different manner to usual behavior to protect his young one. Right? So paternal behavior can occur. And also, it is thought that they are embedded in our genetic code. Genes may also play a role. So activation of some genes may happen, right? So that is called maternal behavior. And then in psychiatry, when you go to fourth year, final year, you will learn more about this maternal behavior and abnormal maternal behavior. Sometimes uh, mothers who give birth may develop depression or what is called low in mood. Uh, Mood may go low, and sometimes what is called maternal blues, blue, maternal blues, or if it is severe, what they call maternal or postpartum blues or postpartum depression can occur, which may need treatment or careful attention, because it may be dangerous for the baby as well as for the mother. Right? So therefore, you have to be aware about postpartum depression. Right? That is after childbirth. Sometimes female can go into depression and they will not look after the baby or even actively harm the baby sometimes. Right? So therefore, you have to be aware. And then we go to other types of things. So I told you about in that initial slide, the sexual behavior, maternal behavior, and then fear, rage, anger, those things were there. So let's have a look at fear, right? And as you all know, if we sense some danger, we develop what is called fear reaction or fear response, and it's a kind of emotion, and we behave accordingly to avoid that situation or to get away from that situation, right? And this fear can be evoked by stimulating hypothalamus and amygdaloid nuclei. So artificial, if you put some electrodes into the brain and stimulate electrically, the fear response can be generated. So that means these areas are involved in generation of fear response, fear. Right? And this amygdala, if you experimentally destroy it, leads to absence of fear reaction. And also it's associated autonomic and endocrine manifestation. When there is fear, we know that we start sweating, heart rate will increase, catecholamines will secrete. All these things will become absent if you destroy amygdala. Right? Bilaterally, if you remove amygdala. And it is said that say normally monkeys are terrified by uh, the sight of snakes. If they see a snake, cobra or some snake, monkeys are very scared and they run away. But if you destroy amygdala and uh, show a snake, it will not have any fear. It will reach out for the snake and even hold it or try to handle the snake by his hand. Right? So that much of effect is there in amygdala in generation of fear response, right? So actually, some people use this knowledge, the monkeys' fear for snakes, to protect their crop. Uh, in coconut trees, you may have seen they draw diagram of a snake. නායක වගේ එකේ පොල් ගහේ කඳේ ඇඳලා තිබ්බම වඳුර ඇතින් බය වෙනවා, right? So I don't know whether the modern days monkeys would get scared, but earlier that was a usual practice, no? Right, so that they do not destroy the coconut plantation. And when there is a fear, it's a feeling on one hand. On the other hand, as I told you, it has emotional, physical response. So sweating, pupillary dilatation, hovering, but it's not covering, COW, hovering, that is crouched down in fear. Guli vela mulu ganilla wadi inne. You go to, so that is called hovering, and they can happen. And I will show you some pictures. So what can you see here? So this is probably a hand with lot of sweat. So sweating can occur with fear. What is this? Can you see here? What is this?
Pupillary dilatation.
Yeah, pupillary dilatation, right? When you are scared, when the sympathetic nervous system gets stimulated, your pupil get dilated, right? What is this? This is crouching down in fear. Right? So that is, and then this has become very controversial photograph with American camp in I think Cuban territory. They have had a camp or prisoners of war taken from Middle East during the Desert Storm War. Iraqis have been taken as prisoners and were kept in a prison called Guantanamo Bay, right, in Cuba, Cuban territory, but belonged to Americans. And they have tortured these prisoners. So that is why human rights activists have somehow got hold of these photographs, and they are prisoner was kept naked, and some Alsatian and other types of dogs were barking at them, and he's scared to death, like like trying to crouch down in fear of his life. So that's a fear response, and this is the same response in animals. So when the owner comes with a cane or something and blaming the dog for misbehavior, he is scared, and like same kind of thing. Muluganila, just just like this child in the upper diagram, uh, this dog also is in fear, right? Right. So we are not different to animals, right? And then comes the rage response. So fear is one thing, rage is anger and fighting or attack reaction, very agitated or violent reaction, and it is uh, associated with some autonomic responses like piloerections, that is standing up of hair, and then pupillary dilatation, again autonomic activity, and rolling, gurravadam, garjanakan, right? So right, so these are like rage response from an animal, and again humans are not different. Same face cut, no, to the tiger, right? So we also have this rage response, very much similar to animals. As I told you, when you remove the neocortex, our limbic system take over, and we behave like animals, right? Uh, so you have to be careful and be aware. You can kind of modify a little bit and become a little better if you are aware of this. So as 42nd batch of medical students, hereafter I do not expect this type of behavior. Try to behave humanistically. Uh, so no rage response expected from you, right? Knowing your physiology and neuro physiological behavior things, we expect better behavior. Okay, right. Let's move. And so major irritants make even normal individuals lose their temper, but the normal individual will ignore minor stimuli. Right? So minor stimuli are ignored. In some brain lesions, this balance is lost. So there's a balance to respond with a rage response, and there are certain other things to inhibit it. So normally we are in good temper. හොඳ මානසිකත්වයෙන් අපි වලියට යන්නේ නැතුව ඉන්න එක. Normally that is what is expected, right? But if we remove certain areas, the removal of neocortex or destruction of ventromedial hypothalamic nuclei or septal nuclei, this balance can be lost, right? And if you remove amygdaloid nuclei bilaterally, it leads to abnormal placidity, opposite of rage. Right? I told you to introduce this word earlier, opposite of rage. So placidity, that means they don't respond to situations where we would expect it to become angry and a rage response. It will not occur if you remove this variant, right? And then it is shown that gonadal hormones, so that means not only neural hormones have facilitated role. So androgens will have, particularly males, some rage response, right? So and then it is thought that males uh, aggressive behavior is due to testosterone, or at least testosterone plays some role in that behavior, right? And then few words about reward and punishment. uh, so in our brain there are areas which will give pleasure to us when those areas get stimulated. On the other hand, there are certain other areas when stimulated will cause pain or unpleasant experience when those areas get stimulated. So those areas are known as reward centers and punishment centers, right? So, so stimulation of reward system or pleasurable areas in brain causes experimental animals to repeat the action. So, say, uh, say if there's a cage, they have done a lot of animal experiments and put some rats there, and then you put some pedal. Then පාගල වතුර ගන්න තියෙන වගේ you put some pedal. When that pedal is pushed, if some nice food, a little bit of nice food drops into the cage, animal will learn it and he will, that's a pleasurable experience. He will press it again and again and get more and more food. On the other hand, if you put a small electrode into the brain and locate the tip of the electrode in near a punishment center, and if you press that pedal and that punishment center gets stimulated, he will not press it again, right? So he will avoid punishment activity, but he will use the pleasurable activity. So you can have an electrode in the pleasure area in the brain and he will repeat that. But punishment area getting stimulated, he will avoid it. Say physically also you can do, when you press the pedal, if a splash of cold water comes and hits the face, he will never do it again, right? So that's very easy to train. Which system is more powerful, punishment center or the reward center? Unfortunately, physiologically, it has been demonstrated by experiments that punishment center is more powerful than reward system. So, so by punishing somebody for doing something wrong, you can get it avoided easily, rather than giving a gift or prize to somebody who does a good thing. හොඳ වැඩේ කරන මිනිහට ටැග් එකක් දෙන්නට වඩා වැරදි වැඩේ කරන මිනිහට ගහලා හදාගන්න එක ලේසි. Right? So probably that may be ancestors also knew that by experience that this is how it works. And in the past, there have been a lot of punishment systems. Dimi go to dala hari, dawas kana kannu nodi kiyala hari. They try to correct their young ones or children. But nowadays, if you try to do that, you will end up in courts for child abuse or some other thing, right? So, but physiologically, punishment center is more powerful than reward center. And the reward system, dopaminergic pathways from the ventral tegmental areas to the nucleus accumbens. Okay, so all these details are not much necessary. And the punishment system, again, posterior hypothalamus, the dorsal midbrain and the entorhinal cortex are involved. Right? So different areas are involved anatomically, but if you know about the behavior related to it, that is enough for physiology. That means if they will try to avoid anything, any activity which will stimulate the punishment center. They will try to repeat any activity which will stimulate the reward system. Right? So that is what it is, right? And then there are other types of emotions, like as I told you, happiness. Happiness is there, that's an emotion. And then laughter, that is outward expression of happiness. You laugh loudly, and this knowledge is being used artificially in the teledrama industry or film industry or even stage dramas and then television, radios, so much so that they have what's called canned laugh. What is canned laugh? Canned means like salmon or tinkerline, canned food. Like they pack laughter into something. So that means in the radio or television, when they crack a joke, say there are two people, one person is telling something funny and the other person may smile or laugh, but in the background there is a big laughter. So that is called can laugh. So when you do that, the audience will be very much happy. They also laugh, right? So if there are only those two people cracking the joke and other person responding, that much of response will not come. So in the early film industry, this canned laugh was there to large extent. Even now, you may come across it. No? So that is called canned laugh. And then humor, that is ability to recognize something as funny and enjoy it. So sense of humor, have you heard that word? So some people have good sense of humor. So that means they are able to enjoy the life and like uh, see happy things and good things as happy. And there are some people who do not have a sense of humor. Viluak කරලා මොකක් හරි joke එකක් තියෙන කතාවක් කිව්වට පස්සේ උන්ට යකා නගිනවා මොන බම්බුවක් ජපුවක් මොකටද කියලා. Right? So that is they do not have sense of humor. So humor is important part of behavior uh, to be able to enjoy the life, right? And then mood changes are normal for anybody, right? All of us do not have a very stable mood. Certain days we have a very good mood, certain days we have little low mood or low in mood. So our mood is fluctuating, like going like this, right? So if I get a, I will try to share whiteboard. So our mood is not like this. Our mood is like this. That is normal. Certain days we feel better, certain days we feel little low. So that is not unusual. But if our mood is like this, that is called a bipolar disorder. Certain days we are extremely happy, and like even without any stimulus, we may be singing and drinking tea after tea or coffee after coffee, not sleeping, turning your radios and TVs everything loud and dancing, and behaving like a crazy man. We call it mania or manic episode. Or in certain other times, few weeks later, you may go into depressive mode. So this is depression, lower end, right? So this is called manic depressive psychosis. Manic depressive psychosis. That's a psychiatric illness. You must need treatment, right? But this one uh, here, so this kind of change, you don't need treatment. This is normal, right? Slight fluctuation of mood. It's good. It's not abnormal. This is like surface of a lake. ගවක නිකන් මතු පිට බලන් ඉන්න පොඩ්ඩක් කරලා ගහුවට අපි කලබල වෙන්නේ නැහැ. But if you see something like this, you may expect a tsunami, right? So then you are scared. So this is abnormal, right? So this is what I learned in psychiatry. So you also remember. And there are some people who are in between, kind of either a little bit too much, or some people who are a little bit lower, but not this much. Not like a psychiatrically ill person, but little lower. And this is called, I will introduce these two words. So I told you this is mania. Manic means mania. And this is, if it is slightly above, this is hypomania. Mania mana ini cukak tadi. Hypomania. And some people are just like that. They have what is called constitutional hypomanic or hypomania. So that is little bit bigger than this one. So this is mania here, and this is normal behavior. So the constitutional hypomania is important sometimes. Say, for example, some stage announcers have constitutional hypomanic features. They need that. If I go and introduce a singer, මෙන්න පිළිගන්න ඊළඟ ගායකයා කියලා එහෙම කිව්වට වැඩක් නැහැ නේද? So you tell, then ඊළඟ ගායකයා ඔබගේ, so they get the audience with them. So that is constitutional hypomanic behavior. Right? On the other hand, there are some people who are not within the normal range probably, but not pathological. Pathological depression is here. So if somebody is here, it's depression. But this is what is called, this is constitutional hypomania. This is constitutional depression, depressive. Personalities, right? Personalities like little too much lower down, and they are also important. Say, for example, in order to run a civil society with the law and order, you may need constitutional depressive personalities. Like, good administrators, they keep everything straight, right? So, අටට රතු ඉර ගහනවා විනාඩියක් පහ වෙලාවක් වැඩිලිද. So that is also needed to maintain law and order within a society. So the constitutional depressive behavior, constitutional hypomanic behavior are there within us, right? But a lot of us have normal fluctuation of mood. Very rarely, maybe 1% or even lesser percentage of people will have abnormal fluctuation, what is called bipolar disorders. Bipolar means in certain times of the year, they go into one pole, they become manic. In certain times of the year, they may become depressive. So that's bipolar disorder. Or some of them are always manic, some of them are always depressive. And in psychiatry, you will learn more about it, but that is part of our behavior. Okay, I will stop sharing the whiteboard and go back to my slide. Right. Then I will go to some abnormal behaviors in relation to eating, right? Eating disorders, and these are well known. And one of the well known or the best known eating disorder is anorexia nervosa. Anorexia nervosa, that is, this generally it affects most of the time females, but males also can get affected rarely. But most of the time it is females. They are scared about their figure, and the desire to lose weight becomes more important than anything else. මම මහත වැඩි කෙට්ටු වෙන එක තමයි මගේ ජීවිතේ එකම පරමාර්ථය. වෙන කිසිම දෙයක් නැහැ. Right? So that is the only thing that drives them for all the activities, to lose weight. Right? And that happens because of some abnormality probably in some neural circuits or whatever. And there have been a lot of studies being done, but no real conclusion as to why this is happening. But it's the altered body image. So when they go in front of a mirror, they think that they are too fat. Actually, they are not fat to the other people, but they think that they are too fat and they want to lose weight. And so much so that they may become emaciated like this. I will not eat, I won't eat, I am fat. So they, it's like dushkarakriya kalla wage baluwaham. But there are female models like this because of distorted body image, right? And they think that they are too fat, and it's not uncommon. But in Sri Lanka, I think we do not have many, but in the West, there are a lot of people with anorexia nervosa who deliberately avoid food, do too much exercises to keep their figure intact, and like that, big time problem, right? And there are models like this with anorexia nervosa, and they do not maintain normal body weight because they refuse to eat enough and often exercise obsessively. පැය ගණන් exercise කරනවා. And sometimes force themselves to vomit or use laxatives to lose weight. එක්ක බඩ යන බේත් කරනවා එහෙම නැත්නම් කන්න නැති වෙන කාපුව වමනය කරනවා. So these are parts of clinical features of anorexia nervosa. And it is so severe, it can disturb the other bodily functions, and menstrual functions may cease. So they may develop what is called amenorrhea. Amenorrhea, that is absence of menstruation, right? And then because of poor energy consumption, poor nutritional consumption, they may become osteopenic. Bone mass may go down, osteoporosis through loss of calcium, right? And then hair and nails become brittle and fragile, and skin dries. They may have mild anemia. Muscles, including heart muscles, waste away. Check right? Severe constipation, drop in blood pressure, slowed breathing and pulse rate, internal body temperature falls, causing person to feel cold all the time, depression and lethargy. All these are clinical features of anorexia nervosa, right? So this is again diagrammatically showing so the brain can't think right, fear of gaining weight, sad mood, irritable, bad memory, fainting, changes in brain chemistry. Hair thins and gets brittle. Heart, low blood pressure, slow heart rate. The flutter can occur, or even heart failure may occur. Anemia and other blood problems, the weak muscles, swollen joints, fractures, osteoporosis, renal stones, I don't know why, kidney failure, and body fluids, low potassium, magnesium, sodium, constipation or abdominal bloating may be experienced, and period stop, that is amenorrhea, bone loss, growth problems, trouble getting pregnant, and like that, a lot of other things. And then skin, bruises, because vitamin K deficiency maybe, and then also protein deficiency, collagen deficiency, vascular support may not be there, dry skin, and lot of other things. All of these you don't have to remember, but like you have to be sensible. If there's an MCQ, you should imagine what a anorexia nervosa person would look like, and you should be able to guess intelligently the correct answer, right? And then there's another similar entity but slightly different, known as bulimia nervosa. It's not anorexia nervosa, it's bulimia nervosa. And this anorexia nervosa brings me to takes my memory backwards to our medical student days. Those days, we had Professor Niriyallage Chandrasiri as the forensic medicine professor, and students, on the the final night, they had this Gompat dramas. Once I think they have imitated Professor Niriyalla. Professor Niriyalla was telling there's this postmortem laborer whose name is I think Piyadasa. Piyadasa kapana bada බලන්න කොට මේ පේන්නේ නැද්ද මිනිහා දැක්කාම පේන මේ ගෑණි මේ having anorexia nervosa පේනවනේ හැටි කියලා මෙඩිකල් ස්ටුඩන්ට්ස් හට කියලා දෙනවා බලනවා ඉගෙන ගන්න ඕන ඊට කපනවා බඩ සර් මොකෝ පේද මොනවද තියෙන්නේ ස්ටමක් එකේ මොනවද තියෙන්නේ සර් ස්ටමක් එකේ පාන් ගෙඩියක් තියෙනවනේ right? So, so like that, we, so that is unlikely to be anorexia nervosa, right? So you just want to crack jokes and like get person really irritated probably. So those things, kind of things happened earlier, uh, right? So about bulimia nervosa, same things are there: dieting, that means less eating, exercise, but the new thing is that they have what is called binge eating, what are called bingers of eating or binge eating. That is eating large amount of quantity, breaking all the observations that like precautions they took to keep weight gain. බර අඩු වෙන්න කියලා නොකා ඉඳලා dieting, exercise ඔක්කොම කරලා හිටි ගමන they break everything and then start eating large bulk of food, and then they feel very sad about what they did, and followed by self-induced vomiting. ඊට පස්සේ කාප ඔක්කොම වමන කරන්න උත්සාහ කරනවා, right? And therefore they are not always underweight. Anorexia nervosa patients are always underweight. These patients can be underweight if they eat and vomit everything. They may become underweight because have been dieting, or they are weight may be normal, or if they are unable to vomit, they may become overweight. Right? So they can have spectrum of weight. Right? So and because of induced vomiting, they have chronically inflamed and sore throats, and salivary glands may become swollen, and cheeks and face often become puffy, causing sufferers to develop a chipmunk-looking face, chipmunk appearance of face. And because of vomiting, their enamel may get eroded, whereas teeth begin to decay from exposure to gastric acid. And constant vomiting causes gastroesophageal reflux disorder. And then they may start taking laxatives, badayana bed causes irritation leading to intestinal problems. And sometimes they may take diuretics to lose body water. And severe dehydration due to loss of fluid also may be seen. Right? And so the binge eating, spelling mistake, binge. Binge eating, like they pile up lot of foods and keep on eating, right? And then feel bad about what they did, and then they wanted to vomit, right? And they may induce vomiting by putting their fingers, and so much so that sometimes clinically, if you get a history like this, you must look at the back of the hand to see whether there is damage due to teeth hitting the knuckles here. You can see injury, and also tooth enamel decaying can be observed. So, in order to understand enamel decay in these people, you must look at the normal teeth. Right? Right? And this famous character is also supposed to have bulimia nervosa. You can recognize her, no? That's Princess Diana. And that's the end. So behavior, emotions and behavior can take many different things, and behavior, eating behavior, I talked last two things, anorexia nervosa and bulimia nervosa. But before that, we talked about anger, rage, sexual behavior, maternal behavior, different things. Most of these things are linked to the limbic system, together with endocrine system also is involved, but most of these things, including limbic system, has effect on hypothalamus, and hypothalamus is part of it actually, and superseding the activity of the neocortex, controlling or going beyond the activities of neocortex, trying to alter the inner parts, trying to govern things. And as I told you, limbic system has very long memory, long loops of memory, long loops of neural connections, which may occur recurrently, and bring back memories or some things into your head, and they are very distinctly remembered. Right? Okay, so we will stop there. And I think Dr. Champa will do the reflex lectures again. And we will have a tutorial afterwards. I will let you know the time. Right? Okay, I will stop there.
Yes, sir.